Hello viewers, I am Dr. Nisha Bali. I am Director of Dental Brasstacks and I am here to start a series on pediatric dental care. And I am here with the renowned pediatric dentist, Dr. Jayna Gandhi, and who is highly experienced, and I warmly welcome her to Dental Brasstacks. And Dr. Jayna, it's so nice to have you here, and I would like you to inform all our viewers about this special segment, which is very important. So Dr. Jayna, I would like to ask you some questions, and today the first question is, when should we take the child to the pediatric dentist?
Well, first I would like to thank you, Dr. Nisha, for having me here. It's an honor. And yes, I think pediatric dental care is slightly neglected amongst our audiences as of now. And it's a very important question that you have asked me, that when is it that we have to bring our child for a dental visit. So most of us generally visit the dentist when we either see something black in the mouth or when the child starts experiencing pain. And that is a stage when you are almost at a late level, when the treatment required would be more extensive. So as a pediatric dentist, I always tell all my patients that the first dental visit has to be either by 6 months of age, that is when the first tooth erupts in the mouth,
Okay.
or latest by the first birthday.
Okay.
So it comes as a shock to many people, oh my
Yeah.
god, so soon.
Yeah.
So that is required so that when you get the child to us, we are able to see whether the teeth are developing correctly or not, and we can let you know about the oral hygiene practices on how to brush the teeth for your child,
Right.
what toothbrush to use, what toothpaste to use, what brushing technique to use, because these are little things. Prevention takes us way forward. Prevention is way better than cure. So if we start early,
Yes.
we definitely keep the health of the teeth going on for a long time.
Yes. Dr. Jayna, I personally want to have a patient base who is healthy.
Right.
I don't want a patient base who is a patient forever.
Exactly.
Yeah, so our aim is basically to make a child a normal, lead a normal life.
Absolutely.
Not a patient-based life. So preventive care is definitely better than the
Curative care. Absolutely.
So that is definitely our aim. And what do you think? What we should do to make that happen?
Absolutely. So again, that's a very
Especially
great
this
thought.
age group, which
Exactly.
is 0 to 2.
0 to 2.
So
yeah.
today the focus is 0 to
0
2.
to 2, yeah.
Yes.
So like I said, yes, you have to visit as soon as the first tooth erupts, which is by 6 months of age,
Right.
or latest by the first birthday.
Right.
So we also counsel expecting mothers on how to take care of their oral health,
Right.
so that the child's oral health while the child is in the womb is not affected.
Right.
So again, that might be a new thing to our viewers, that how can an expecting mother impact the oral health of their child, but that's a fact. If you maintain your oral health well,
Yes.
the oral health of the infant is also developed accordingly. That is one. Second, after that, once the child is born and once you start breastfeeding the child,
Right.
at that point of time also, it is very important to clean the gum pads.
Yes.
So I always advise the parents, the young mothers,
Yes.
to use a wet gauze piece to
Right.
clean the gums of the child,
Right.
even when the teeth are not there in the mouth.
Right.
And then subsequently move on to a finger brush.
Right.
Then the other important thing is, most of us are not aware about the fact that the breastfeeding and bottle feeding has to be weaned off at a particular age.
Yes.
Breastfeeding maximum till 6 months of age, and bottle feeding not beyond 1 year of age.
Absolutely, Dr. Jayna, because the maximum problem starts with bottle feeding.
Absolutely. And we call it nursing bottle decay. So either the mother is feeding the child for a long time, or the child is being bottle fed. So there is a very simple logical reason behind that, which I explain to my patients, that if the child is feeding at night with either a bottle in the mouth or the mother is feeding the child, what happens? The milk gets stuck onto the teeth. Now the parents generally do not even start brushing. They think that brushing is not required. They will brush, these are milk teeth, and they will eventually fall off.
Right.
But the teeth will fall off. They start falling off at 6 years of age, and they fall off completely by 12 years of age.
Yes.
So, even when you are bottle feeding the child at night, the milk gets stuck and the bacteria at that time, it's a party time for the bacteria.
Yes.
Why? Because your natural defense mechanisms, your tongue, your saliva, they are not acting. So they get a lot of time to cause cavities, to cause decay. So it is very important that even if the child is being till 1 year of age being breastfed or bottle fed, make sure that you give him a sip of water. So a sippy cup where the child can drink water, and maybe with a finger brush or a soft clean muslin wet cloth, you can just wipe off the excess milk which is present on the teeth. And gradually after 1 year of age, you have to stop the bottle and you have to start the child on sippy cups again, even for consuming milk. And then eventually by 1.5 to 2 years of age to normal cups. So if we start imbibing that in our routines and in our practice, all the mothers, if they start doing that, definitely the the risk of getting cavities will be reduced to a great extent.
Absolutely, Dr. Jayna. And one tip I would like to add here, especially for the expecting mothers and the new mothers who are breastfeeding,
Absolutely.
they should eat everything.
Absolutely.
They should eat everything so that
Yes.
the child gets the taste.
Exactly.
And when the child is getting the taste, the child will accept everything. So when from 1 to 2 the child is eating everything, he will like it.
He will like it. Absolutely, absolutely. So, most of the patients, they come and say, if I don't give him milk, he doesn't eat. So, see, that phase will always come. As a mother, I'm sure both you and me have also experienced the same thing. Whenever you wean off the child, whether it is from, even if you do toilet training or it is weaning off, it will take a week to 10 days. And with the tip that Dr. Nisha has shared, that if you are eating everything, the child will develop a taste for everything. So start early, start on time, and I think that's the key to a better oral hygiene and a better future for the kids.
Thank you, Dr. Jayna, and we'll connect with you soon with more topics.
Absolutely. Thanks a lot. Thank you.